revised framework of healthcare. Now, healthcare delivery needs should be organized so that they can respond adequately to these changing needs. In the past 20 years, information technology has revolutionized virtually every facet of our lives. Transcription of data from paper into an electronic database can be a significant source of error. However, often for valid reasons, data collection is initiated on paper forms without considering how to convert them to data to the electronic format later. And we now have populations that are mobile, moving from place to place. So it makes tracing health records even more difficult at their points of care. Adding to this complexity, most patients are cared for by most patients are not cared for by a single physician or one
She's having some network challenges.
organization, but a specialist, diagnostic technicians, and electronic health record.
What happened? Share your screen again. I think there's some network fluctuations. Okay. Unmute yourself, please. Your audio is still muted. Dr. Saror, I think she's still having some network challenges. Oh, she has gone offline again. Uh-oh. 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 All right. Anyway, before she comes on, at least it still gives time. Dr. Akins, it still gives time for additional people to join. Eh? Okay, she's back. Unmute yourself. Okay. Can you? Okay, network is fluctuating. Maybe you put off your video. Maybe it's consuming so much data and slowing the whole thing down.
Okay.
Put off your video and then share your screen.
Okay.
Mm.
Okay.
So share your screen again.
Sir, can you see the screen?
Yes, we can see the screen. Carry on.
Hello, sir.
We can see the screen.
Yes, we can see the screen.
Okay, sir. Electronic health records can be a comprehensive tool containing medical records or similar documentation of past and present physical and mental state of health of an individual in an electronic form and providing better care. The increase in mobility of the population and of health personnel necessitates that health records are available on an as and when basis from more locations. The aim of this presentation is to acquaint the doctors of Family Medicine Department, Garki Hospital, Abuja, with electronic health records. And to achieve my aim, I shall be taking a look at the history and origin of electronic health records, definition of terms, concept of electronic health records, differences between electronic health records and electronic medical records. I shall also consider the stages of health records, components of electronic health records, standards of electronic health records, the family physician and electronic health records. We shall also take a look at the functions of electronic health records, benefits of electronic health records, challenges, and some barriers to adopting electronic health record system. A look at the history and origin of electronic health records. In the mid-1960s, the Lockheed unveiled clinical data management system. It was one of the earliest systems, processing system that focused specifically on managing clinical data, and it is now called the Hospital Information System. In 1965, the US Library of Medicine moved to computer systems. It converted the Index Medicus, which is a comprehensive index of the world's leading biomedical literature, to a computer-based version, later called the Medline, thereby beginning the shift to an electronic rather than a paper-based information resources. In the late 1960s, problems-oriented medical record was introduced. The physician Larry Weed introduced the idea of recording patient information electronically, aiming to generate a record that would allow a third party to independently verify the diagnosis. In 1972, the first electronic medical record system was developed. The Registrar Institute developed the first electronic medical records system. While in 1982, the Dragon system pioneered the voice dictation software. And then in the early 1990s, we have the emergence of the World Wide Web, which began to give people access to health information online, and then set the stage for a web-based electronic health record. In 1994, the Clinitech sells their software to convert paper records to electronic health records. And then in the year 2001, Clinitech became next generation health care. In 1996, the Health Insurance Portability and Accountability Act of the 1996 was enacted by the 104th United States Congress and signed by President Bill Clinton. All softwares that are used in health insurances claims must follow the Health Insurance Portability and Accountability Act, HIPAA, regulations on health records use, disclosures, and confidentiality. In 1999, an e-clinical works was started by 4 engineers and a physician. They partnered with the Sam's Club and Dell to sell their brand of electronic health records and practice management software as a turnkey solutions for small practices. And then in 2002, the GE acquires the Medical Logic and Millbrook. While in 2004, President George W. Bush promotes adoption of the electronic health records And then in 2009, Health Information Technology for Economic and Clinical Health, High-Tech Act, was passed as part of President Obama's American Recovery and Reinvestment Act of 2009 stimulus package. In Nigeria, in 2013, the Lagoons Hospital Groups was the first in Nigeria and Sub-Saharan Africa to implement the electronic medical records. These Lagoon hospitals provide a range of primary and tertiary healthcare services across 5 sites in Lagos. Their hospitals are located around the Lagoon Hospital Apapa, Lagoon Hospital Awolowo Way Ikeja, Lagoon Clinic Adeniyi Jones Ikeja, Lagoon Specialist Suites, and Lagoon Hospital Victoria Island. That's the first hospital, or the Lagoon hospitals were the first in Nigeria and Sub-Saharan Africa to implement the electronic medical records. And they were accredited by the Joint Commission International of the United States, which is a body that endorses internationally excellence in clinical practices. In 2016, Olayiwole Bello and his team from the University of Ilorin, Nigeria, wrote a proposal on driving electronic health record system implementation. And then in 2020, Professor Victor Alegjibi Kiri and Aaron published in January 2020 in the Nigerian Postgraduate Medical Journal on electronic medical record system, a pathway to sustainable public health insurance scheme in Sub-Saharan Africa. Let us take a look at some definitions of The term electronic health records and electronic medical records are often used interchangeably. However, there are some distinct differences between them. Health record, as defined by the UK, is a collection of clinical information pertaining to a patient's physical and mental health compiled from different sources. These health records contain demographic data, next of kin, general practitioners' details, and most of the following: medical history, examination, diagnosis, treatment, results, investigation, nurses' records, referrals, discharge, postmortem reports, and amongst others. Then the Singen's Medical Dictionary defines health record as a comprehensive compilation of information traditionally placed in the medical record, but also covering aspects of the patient's physical, mental, and social health that do not necessarily relate directly to the condition under treatment. Electronic health record is defined as a systematized collection of patient and population electronically stored health information in a digital format. It is a more longitudinal collection of electronic health information of individual patients or population. And it is also a digital version of a patient's chart, but it is a more inclusive snapshot of a patient's medical history. Electronic health records is designed to be shared with other healthcare providers, usually from different organizations or within the same organization. Then the electronic medical record, on the other hand, is a single practice digital version of patient's charts. It contains the patient's medical diagnosis and treatment by particular physician, nurse practitioner, specialist, dentist, or surgeon, dentist, surgeons, or clinic. Personal health record is defined as an electronic application for recording personal medical data that the individual patient controls and may make available to health providers. Let us look at the concept of electronic health record. The term electronic healthcare is widely used in many countries with variation in extent of coverage and the modes of operation. The electronic health record contains all personal health information belonging to an individual entered and accessed electronically by healthcare providers longitudinally over different episodes and extends beyond the inpatient situations, including all ambulatory care settings at which a patient receives. So basically what we're saying is the electronic health record, it's a general or a central collection of the patient's information, not only when the patient is it's not only an inpatient situation, but if the patient has to access care from emergency settings or other facilities, the electronic health record should be able to provide that information to any healthcare giver at any point in time. The image below it's an integrated platform of the electronic health medical records showing different organizations. There are different organizations, just like the Hospital A and Hospital B. There are different organizations, or within an organization, you have different specialists accessing the individual. For Garki Hospital, we have some of our patients that are referred to Maitama, referred to National Hospital or other centers for other care. If we run electronic health record system, the patient's information from our hospital should be able to be accessed from from Maitama or National Hospital without much difficulty. But Garki Hospital runs an electronic medical record system where it is only the hospital that can access the patient's information. Such information cannot be shared to other specialists or organizations for patients' care. Let us take a look at some differences between the electronic health records and the electronic medical records. For an electronic medical record, it is mainly used by providers for diagnosis and treatment. It is not designed to be shared outside the individual practice. The electronic health record, on the other hand, is designed to share patients' information with authorized providers and staff from more than one organization. And it also allows patient medical information to move with them to different specialists, different laboratories, imaging facilities, emergency rooms, pharmacies, as well as across state lines. So if the patient moves from Abuja here, needs to be attended to in Kano, the hospital in Kano should be able to access the records readily if we run an electronic health record system. There are some 3 R's that we should take note of. These are the electronic medical records, which we've said that it's managed by a single healthcare provider. Then you have the personal health record managed by the individual, the patient directly, and can be made available to the healthcare providers. And then the electronic health record, which is a central collection of both the patient's personal health record and the electronic medical records.
Network. I think she's having some challenges with her network.
Yeah, probably some calls are coming in and disrupting the.
Yes, probably. Yes, exactly. She's using probably her line, an active line for internet. She has gone off. Oh, interesting topic. But this network is interrupting. Okay, so anyway, we hope everyone is has been following. We can post our questions here. But the electronic health records, the patient health records, and the electronic medical records. You can see the differences she has outlined and she has, brought to light there. So, and what we actually run in Garki Hospital is the electronic medical records, of which you take a particular health facility, takes complete control of the medical records of the patient. But the patient health records is managed by the patient, his or herself, and then the electronic health records by different healthcare providers or institutions. Okay, she's back. Okay.
Sorry, I didn't realize I'd gone off.
It's okay, it's okay. Carry on.
Yes, sir. Yes, sir. So for record generation, it is necessary to adhere to the following rules. It must be legible. It must also have adequate, relevant health information in a precise and concise form. And then there should be proper coding and indexing of information. For the records keeping, records are kept for presentation when needed. There are two systems of record keeping. These are the computerized systems, which is the electronic medical records, then the card or paper health records. We also have two basic systems for filing. These are the numerical filing system and then the alphabetical filing system. And then we also have two types of record keeping. The first is the home-based records, and then the second is the hospital or clinic-based records. Both record keeping require registration of patients in the hospital, but after the documentation of health information, the home-based record is kept by the patient and presented at subsequent visits. For record retrieval, we have two major systems we use to retrieve records. These are the ICD-10 and ICPC-2. I will go into more details on this in subsequent slides. This slide is a table showing the pros and the cons of paper records. For the advantages, it's less technologically involved. You don't need much of the technology. The cost of implementation is less. You don't need much training to be able to implement paper records. But the disadvantages are it is inefficient, it is costly storage and retrieval. Most times the information are not readily available. There are a number of times when patients will come to the hospital and you can't trace their files. Sometimes we have to open new files and then the old one with all the documents will be lost. These things are part of the disadvantages of the paper record system. Let us now take a look at the components of an electronic health record. Components of an electronic health record include administrative system components. And under the administrative system components, we have the registration, admission, discharge, and transfer, which is abbreviated as RAD data. The registration, admission, discharge, and transfer data are a key component of the electronic health records system. These data includes vital information for accurate patient identification and assessment. And it includes and not limited to the patient's name, demographics, next of kin, employer's information, chief complaints, and patient's disposition. The registration portion of the electronic medical record contains a unique patient identifier, usually consisting of a numerical or an alphanumerical sequence that is unidentifiable outside the organization or the institution. For Garki Hospital, our EMRs are just pure numbers. We don't have the alphanumerical system. We don't run the alphanumerical system in Garki. Then the other components of the electronic health records are the laboratory system components. Usually the laboratory system could be a standalone system. You have the radiological system components, which are used by the radiological department to tie together patients' radiological data. Then we have the pharmacy system components, the computerized physician order entries, abbreviated as CPOE. And in this, it permits the clinician to provide electronical orders. You place orders, we send patients to the lab electronically, we send prescriptions electronically, radiological imaging, it's sent electronically. That is enabled by the computerized physician order entry. Then we also have the clinical documentation, which system which enhances the electronic health records by providing electronic capture of clinical notes, patients' assessment, clinicians' reports, such as the medication administration and records. Some examples. In an electronic health record, as in manual records, the treatment and medication orders must be signed. The authenticity of an electronic signature is extremely important, particularly when the record is used, the table, this
Okay, she went out briefly. I think she's still online now.
sorry, I went off again.
It's okay, just keep sharing your screen and continue.
Yes, sir. So the image depicts how an electronic record, a health record, is collected on an individual patient and then stored in a database, and it's being accessed by different healthcare providers at different points in time, or different services points, all of them having access to the database for easy services or proper services. This is also another graphical representation of how the electronic health record functions. Now, examples of clinical documentation in an electronic health record are the physicians or nurses or other clinician notes. We also have flow charts, which includes vital signs, input and output, problem list, medications, administration, and registration. We also have the perioperative notes, discharge summaries, transcription document management, medical records abstracts, durable powers of attorney for healthcare decisions. All these things are information that could be found in an electronic health record. The list goes on to utilization management. We'll now take a look at the standards of electronic health records. In order for us to be able to interoperate, the electronic health record needs to be standardized, or there should be standards set so that we can understand our language or clinical vocabularies. The healthcare message exchanges, in which one system exchanges messages with the other, will be uniform. Then the ontologies in which the content or the structure of the data entitled is related with each other. We can easily relate with each other when it comes to the information we store, and that there's a need for a standard to be set so that anybody anywhere would understand what any physician or healthcare provider anywhere is trying to say. The electronic health record systems, as we said earlier, must follow the HIPAA regulations. Now, some of the bodies or organizations that are responsible for standardizing the electronic health records are Health Level 7, abbreviated as HL7, the Comité Européen de Normalisation Technical Committee of 215, and the American Society for Testing and Materials, E31. These organizations have brought out a sort of standardized what we represent our information. This presentation must be completed. The ICD-9, ICD-10, which is the International Classification for Diseases and Clinical Modification, NDC, SNOMED, CDC, and HIPAA. These are all standard ways of, standard forms in which we communicate or interact with ourselves as healthcare professionals in electronic health medical. Records. For in Garki, it is the 10th vertical classification of diseases and related health problems. The medical classification was formed by the WHO. It contains codes for diseases, signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injuries or diseases. The work on the ICD-10 began in 1983, and it became endorsed by the 43rd World Health Assembly in 1990 and was first used by the member states in 1994. The ICPC-2 is an international classification of primary care. Sometimes if you notice some of the diagnoses, if they are difficult to find in the ICD-10, there's another small site that has ICPC-2, where we can find some common headings there. So this one was formed it was developed by the World Organization for Family Physicians or Family Doctors International Committee, Classification Committee, WIC, and was first published in 1987 by the Oxford University Press, ICPC-1, and was revised in 1998 to ICPC-2. That is what we are presently using. Now, we'll take a look at family physicians and electronic health records. Are we still together?
Yes, we're here, where are you?
Okay, thank you, sir.
Yes, we're here.
The family physicians and electronic health records, the American Academy of Family Physicians believes that every family physician should leverage health information technology. This will help us to improve our services to our patients, having them in mind as the center of our care, and also resulting in a safe, high quality care of optimal health for patient, families, and the community. Some functions of electronic health records are health information and data, result management, order management, decision support, where you're able to share information with your other colleagues simultaneously, electronic communication, patient support, administrative reporting, and then population health and health statistic reporting. This image is a table showing on the left, you have different titles against the right, which is the percentage. And then the dark color is for the basic system, the normal system, paper system, while the lighter color is for a fully functional electronic health system. So against every title, you would realize that the lighter color had an advantage or more benefits compared to the darker color in providing these services for the patient. This was done in 2008. The table is as reported in the England Med 2008. I couldn't get a recent one, a more recent one than that. Some benefits of the electronic health records are patient identification at all times. You have information documented at the point of care. We also have standard terminology to be documented at all stages. The electronic health record provides accurate, reliable, and complete data for a better care and decision making, availability of information for present and future care, patient privacy and confidentiality, space for paper records has been eliminated, and most importantly, it's less time consuming in the future. Maybe at the start it consumes time, but subsequently it's less time consuming when we are interacting with the patients. Some challenges of electronic health records are documentation time. Sometimes it could take a long time to document, especially when you're just enrolling such patients into the electronic or a digital format. We also have resistance to change, particularly in Nigeria. This system is still not widely used. We still stick to the records, paper record system most of the time. Then we also have situations where the system is slow. A few weeks ago in Garki Hospital, there was a total shutdown for like an hour and a half where there was no network. We couldn't do clinical, you couldn't post anything. Patients were stranded, doctors and every other healthcare provider was stranded. So sometimes challenges like this can come in the system, or when you've documented, then there's a fluctuation in network and then you lose everything that you had documented. You have to go back and start. Those things could be quite frustrating sometimes. And then we also have the risk of system security. If there's a breach in security, the patient's confidentiality or manipulation of data or information can be done. Some barriers to adopting the electronic health system are the cost of implementation. It is really, it requires a lot of finances to establish such, and then you're not even sure if your investment, you're going to have a return on your investment after you've even established this type of system. Then we also have the risk of privacy and security of electronic health information, clinical workflow disruption. When there's a new technology, it tends to affect the way organizations operate their electronic health records. The table here shows the advantages against the disadvantages or the pros and the cons of an electronic health record system. For the pros, we have a multiple user can view a chart simultaneously. So different people from different places can view the patient's chart at the same time. You also have labs and X-ray results returned automatically to you because it's just sent from the lab into the system and you're able to click at any time. Or if there are any documentations, drug allergies, it's easy to see as it will be displayed in front of you as soon as you open the patient's records. Increase efficiency and improve workflow, improve patient communication and services. You have reduced medical records transportation costs. Some cons are an upgrade problem, including lack of internal or external information technology or support resources. We also have inadequate electronic health record templates that are difficult to use or update. Some of our templates there, even as in the hospital, are actually, let me say for myself, some of the templates are quite difficult to use. We don't even know what to do there. So most times we avoid it, like the step 6, when you're examining the patient. I'd rather go to step 7, which is easier to use. That's my own experience. I don't know what yours is, but these are some of the challenges when we have difficult templates to use can affect such services. In conclusion, for the past 1 hour or thereabouts, I have attempted to introduce electronic health records. We took a look at the history and origins of electronic health records and how it evolved from paper to electronic records. We also looked at the stages of health record, considering the generation, storage, and retrieval. I also took a look at differences between the electronic health records and the electronic medical records, the advantages and their disadvantages. Additionally, we considered the functions, benefits, challenges, and barriers to adopting electronic health record system. In the 21st century, and with the availability of health information technology, the electronic health records have the potential to empower consumers and patients by providing them with easier access to their health information, allowing them to exert more control over their health records, thereby becoming more responsible and more active in their own care, while also facilitating our own communication, facilitating their communication with healthcare providers, professionals. Thank you for listening. My references are as shown on the screen.
All right. Wonderful, wonderful, wonderful. Thank you very much, Dr. Saror. Very, very interesting topic. You can stop sharing your slides now. Okay. Very, very interesting topic. Let's all give her a round of applause. Let's all give her a round of applause. I think she did very well. Her slides were well arranged. They were colorful. She had diagrams there, diagrammatic representation of whatever she was trying to, information she was trying to pass on. So I think they're quite interactive slides, and she tried to carry everybody along, even when the network was fighting us, but it still went well. Thank you very much again for the wonderful presentation. I think you were able to bring out the vital parts of this presentation and also relate it to our own setting. Thank you very much. So for now, I don't know, is there any question in the chat window? I can't see any. So that we all understand very well, of course, or we don't understand, or we're not carried along. Anyway, so okay, slide 48. Dr. Akins said, what type of data representation is that in slide 48? Maybe you may have to share your slide again to go to slide 48. Dr. Saror, you may have to share your slide again. Let's go to slide 48. Can you share your slide?
Okay, sir.
Yes. Go to slide 48, please. Let's see your slide and understand it. Okay. So it said, what type of data representation is this? You understand the question?
I do. I understand the question.
Okay, so what do you think is this type of data representation? So any other residents, can someone help? What do you think this kind of data representation is? You have tables, charts, bars, and all that, histograms.
Yes, sir. This is a bar.
Yeah, yeah. Okay, bar charts. I think, okay, I thought Dr. Nafi was going to say something. I think it's Zozo that wants to say something. Anyway, Dr. Akins, I don't know if she has answered.
Yes, it's a bar chart.
Yes, it's a bar chart.
Stop that.
Say the bar chart. The bar chart, that's the graphical representation here in this slide. So that's all right. Dr. Saror, can you give us, do we have a functional electronic health record in this country?
Sir, I don't think we have a functional electronic health record in this country.
Yes, I don't think so too.
We have a few centers that run electronic medical record system, but we don't yet have an electronic health.
Because I don't know of any functional electronic health records. Most electronic records we have in the country, they are electronic medical records, of which just that facility have access to the patient information there. You can hardly access any patient information or any health information from another facility. So I think you quite outlined that clearly in your earlier slides to differentiate patient health records, electronic medical records, and electronic health records. So electronic health record, it has to be information that can be shared with other health institutions. So I don't know of any center or any centers or facilities that, from which you can access several health information from. So I think we don't have any functional one, except someone who want to. Okay, Dr. Akins, you raised your hand.
Yes. Actually, in the Ministry of Health and in the across all the various levels of in the Ministry of Health, from the local government to the state to the federal ministry, they have what we call the health information management system or so. Yes. So which they usually use to collect data from the various health centers, institutions, and all that. I am not in the ministry, so I may not be able to say confidently whether it fits into the definition of electronic health record. But but I know that probably they get their data in the paper form, in hard copies from the forms that all those centers have filled, and then they now start entering them into the that electronic record. So maybe somebody in the ministry or Dr. Ibuta can help us out. Probably must have had one.
Dr. Okoli is not here. She would have helped us with that. Dr. Okoli is not here. should have, or Dr. Jumbo, those in the Ministry of Health would have helped us with that. Yes, I know there's this information management system and all that they use there, but I think it's more of their own data on their research and not personal patient records. Because whatever projects they run there, it's shared with their various offices and all that, but I don't think it has access to personal health records of patients. And I don't think you can access it from other facilities. But maybe we'll get more information from those in the ministry. So, but apart from that, I don't know of any other one that is fully functional. Most systems we run here, the electronic medical records, of which that facility just has access to the health information of the patient. And then there's one slide that was very interesting too that she mentioned, the challenges. Most of us have encountered these challenges. For some of us that were here when this EMR, the electronic medical record, was introduced in Garki Hospital, I think we can identify there were serious hitches and challenges at those initial stages. You know, yes, a lot of people didn't want to even accept it in the first place. You know, Nigerians or blacks, or I don't know, people are just difficult to change, or a lot of people find it difficult to even move forward with technology. So they feel, okay, it's slower, it's time consuming, it's more, you have to undergo training to be able to use it. Some people that were not too familiar with the computer alone found it very difficult to, get used to. So we had a lot of challenges, and if not for the management that insisted it had to stand. In fact, there was a time they were almost reverting to the paper records again, So management insisted. I think Dr. Onu really spearheaded that then and insisted and stood his ground and ensured that this electronic medical records was not changed back to the paper records. So we all have our personal challenges and experiences with the electronic medical records, and she also really brought out most of those personal challenges, and I'm sure some of the ones she has had, a lot of us have had. Have any other thing to share, we can share now. But I think in overall,
I have a personal.
Okay.
I have a personal experience of of one of the challenges.
Okay.
Yeah, when we were doing a patient approached me some time ago and said he wants to copy out the.
Yes.
He wants to copy out his medical. The patients have a way of getting to us. They first of all try to form some friendship,
yes,
and boost our morale, and before you know it, they will make some demands. So he gave me a flash. He wanted me to copy out his, but I told him that this thing is not something I should do, and it's the property of the hospital, and probably there may be some proper channels that you can use to get, because under the HIPAA rules, I think the patients can have access to their health records, but in Nigeria, I don't know if HIPAA rules apply. So Dr. Saror, maybe you can help us with that. If some of those standards apply in Nigeria, So how do we handle such kind of? Some patients will come and they want to even edit their records, especially when we're still using the paper one. There was time a patient came. He was. I think he was preparing to be employed or to be appointed into a political office. So he came to the private hospital I was working, and where they use a paper document, and he wanted the part that had the diagnosis of cancer to be removed from the file. So these are some of the challenges that we face. Thank you.
Thank you very much, Dr. Akins. Yeah, very true, very true. A lot of patients have approached us one way or the other for some favors and all that, but we all know how the system works, and we'll have to continue to remind ourselves and know how to do the right thing. So I don't know if our chiefs have any contribution or comments or question before we end the meeting. It's almost already 9 o'clock, 2 minutes to 9. Okay, HOD was commending your presentation, Dr. Saror. Thank you.
Thank you, Ma.
Thank you, ma'am. All right, I think there's no other comment. Okay, in the absence of any other thing, I think I'll be ending the meeting now. Thanks everyone for attending today's meeting. We'll see you on Thursday, same time, same station. Let's all have a good night.
Thank you very much, sir.
All right, thank you, Dr. Saror. Thank you.